I was the first dermatologist, first specialist in this area, maybe in the county. I think my initial office was probably no bigger than this room. So the vision was to provide quality, specialty dermatology care in a community where people either didn't get that care or they were going into the Emory area. And many of my earlier patients expressed their gratitude that they were able to find young, well-trained doctors, well, not young anymore, but that were in this area. I used to be a pediatrician. I was originally trained in pediatrics and then board certified in pediatrics. And I practiced in the Tucker area for about 3.5 years, built what ended up being a 5-doctor practice. And my wife knew I was not totally happy doing pediatrics. And one day I mentioned to her that I might like to go back to school and that I'd given it some thought. So she and I talked and she said, if that's what you really want. So we ended up pulling up roots and moving to Augusta. And I left that practice behind and did my dermatology training in Augusta. Then I had to figure out what to do after that. And so some friends that knew me when I was a pediatrician called and said, what are you going to do? And I said, I haven't really thought about that. They said, well, we're starting a younger group of physicians in this Snellville area. A new hospital has been built, and we need a dermatologist. So I said, well, okay, sounds good to me. So that's really how it all started, the summer of 1978. It was not Gwinnett Dermatology at that time. I don't even think I had a name. Just a very small office that I shared with a surgeon, actually, and we shared an employee. And I was in that building for probably 3 years when I finally had enough patients and was enough out of debt to move to another place. So I moved to a little rented office, and then I named it Gwinnett Dermatology. That's when the name itself came into being. Well, it goes back a long way. I mean, I see patients now that remember me when I was a pediatrician, and that's pretty satisfying. I've got patients that have been coming to me for 30 and 40 years. When I was a pediatrician, you form what I thought was a stronger bond with the patients. I didn't envision that happening in dermatology, but it does. Well, I think my philosophy is what all physicians should do, is to do your best by the patient, listen to the patient, understand their concerns, understand their needs, try to fix their problems if they can be fixed, make them feel comfortable.